Hello, my name is Dr. Julie Suhr, and I'm a professor and a faculty supervisor in the Ohio University Psychology and Social Work Clinic, and I'm here today to talk to you about sleep concerns during COVID-19. Sleep is really a health variable that healthcare providers should be asking people about at every checkup and medical visit. You spend 1/3 of your life asleep, and that is for very good reason. Poor sleep is associated with impaired immune functioning, changes to your stress hormone secretion, impaired cardiovascular health, changes to glucose metabolism, and is also related to increased depression and anxiety symptoms, as well as depressive and anxiety disorders. Sleep is essential for your physical, mental, and cognitive health. It's important to note that lying in bed is not the same as sleeping. Lying in bed may feel relaxing to the body, but it is sleep itself that is related to good physical, mental, and cognitive health. Many studies show that adults who sleep between 7 to 8 hours a night live the longest. While 7 to 8 hours is what the average adult needs, there are individual sleep needs. No amount fits everyone, and your sleep need might change depending on your circumstances. Sleep needs also change as we age. Older adults generally have difficulties getting a full 7 to 8 hours of sleep, although research is not clear whether this is because they need less sleep or they just cannot get the sleep that they need. Let's take a sleep quiz so that you can determine whether or not you are having problems with your sleep. Get out a calculator. You may need to do a little math. I want you to think about your usual sleep when you're answering these questions. In general, how many hours do you usually spend in bed? Remember, time in bed is not the same as time in sleep. So think about the time that you enter your bed to the time that you get out of bed in the morning. And that is your total hours of time in bed. The second question is how many hours of that time in bed are you actually asleep? So again, think about the point at which you fall asleep and the point at which you wake up. If your total hours of sleep are less than 7, you are likely sleep deprived. You can take these two numbers, time in bed and the time you are actually asleep, and calculate what is known as your sleep efficiency. Here's where you might need your calculator. Take the time that you are actually asleep divided by the amount of time that you spend in bed. Take that result times 100 and you will have your percent sleep efficiency. If your sleep efficiency is not 85% or higher, you likely have poor quality sleep. Another question that is important to think about when judging whether you're having sleep difficulties is how long it usually takes you to fall asleep once you lay down and intend to fall asleep. Remember, you may lay down in bed to do other activities, and we'll talk about that later. But the point at which you intend to fall asleep and the amount of time it takes then for you to actually fall asleep, I realize that you would need to estimate that, and in fact, it's better to estimate it than to clock watch. If it takes you more than half an hour to fall asleep on a regular basis, then you have what is known as sleep initiation concerns. Another important sleep consideration is how often you wake up in the middle of the night or the early morning and you can't get back to sleep. When you have trouble, and this is not just getting up to use the restroom, but actually waking up and being unable to get back to sleep within at least 15 minutes, we would call this a sleep maintenance issue problem. Another important sleep consideration is how often you have trouble with breathing, snorting, coughing, or gasping in your sleep. Or how often does your bed partner complain that you are having trouble with these things? If you often experience trouble with your respiration at night, you may have what is known as sleep apnea, and that's something very important to communicate to your healthcare provider. Finally, how often are you taking any sort of medication, prescribed or over the counter, or even using alcohol in order to help you fall asleep? If you are regularly using substances to help you sleep, you likely need to address your sleep concerns in a new way because those medications Even over-the-counter medications or alcohol may be exacerbating them. This is also something very important to talk to your healthcare provider about. Now, an important thing to know about your sleep is that sleep is a 24-hour process, and it's a 24-hour behavior. So to really determine whether you're getting enough sleep, you have to consider how you feel during the day. Do you typically awake feeling refreshed and alert? Now, if you do not, this might be for a number of reasons. It could be simply lack of enough hours of sleep, but it is also sometimes a sign of sleep apnea. Do you typically awake with a headache? Individuals who often awake feeling not refreshed, feeling not alert, and with a headache are at risk for sleep apnea. And again, this would be something to talk over with your healthcare provider. How often do you have trouble staying awake while driving, eating meals, or engaging in social activity? And how often have you fallen asleep when you're doing more passive activities, such as sitting and listening to something like the television, a concert, a movie, or even a presentation like this one? If you are experiencing the last two of these quiz items frequently, you are suffering from daytime impairments associated with poor sleep. This could be a poor amount of sleep, or a poor quality of sleep, or both. What we do know, and research shows, that poor sleep has major implications for human beings. Poor sleep, in addition to being poor for your physical, mental, and cognitive health, takes a toll on your work productivity. This is especially true for people who must sustain their attention at their jobs, such as workers who must drive long distances, individuals who do manufacturing or factory work, individuals who provide medical or emergency services, and for individuals in the military. However, research also shows less productivity for people in desk jobs and for students in the classroom. Poor sleep also has a significant social, financial, and human cost in that it leads to a lot of accidents at work or while driving. In fact, some studies show that driving while sleepy or sleep impaired is worse than driving while intoxicated. Let's talk a little bit about what it is that drives your sleep. There are two processes that drive your sleep, and the first is known as process S. This is your sleep drive or your sleep load, as you can see in the figure. It's lowest in the morning when you get up, and it increases throughout the day. And what this is showing is that you're depleting your energy reserve during the day, which increases that drive to fall asleep. This is why napping can be problematic for getting good sleep. If you nap during the day, you reduce your sleep drive, and then you may have trouble falling asleep because your sleep drive isn't at its true peak at the time that you would normally fall asleep. The second process is known as process C, or your circadian process. This is a 24-hour-a-day internal clock. It's roughly that for a human being, and it controls many aspects of your light and day cycle, including your body temperature and your sleep-wake sense. You tend to fall asleep and feel the pressure for sleep as your body temperature falls, and then you tend to wake up once it starts rising again. So you can see that process C and your body temperature, you're awake, you're alert, and this drifts off and falls down as you approach the evening. So these processes tend to work together, and the ideal time to fall asleep then is when your process C alerting signals are starting to decrease and your sleep drive is extra high, and this is in the evening. What processes can cause poor sleep? For some people, they are simply predisposed to having poor sleep. They have chronic difficulties with sleep. If anything happens that is going to set off poor sleep, they're likely to experience it. Age itself is also a predisposing factor. As we age, our sleep changes, and thus we might be more vulnerable to other factors that might precipitate an episode of insomnia. Even so, people with predisposing factors can learn strategies to help improve their sleep. Precipitating events can also cause poor sleep. These are things such as stress, travel or jet lag, experiencing an illness. These might cause a temporary problem to an individual's sleep. Again, someone with predisposing factors may be more likely to experiencing experience a sleep problem as a result of these kinds of precipitating factors. For others, they may just have a temporary problem with their sleep. Yet, the sleep problem can become chronic if you engage in maladaptive coping and what we call perpetuating mechanisms. These perpetuating factors are the things that we engage in, the thoughts we have, the behaviors we do that end up making our sleep worse. So, maladaptive strategies to manage your sleep and sleep interfering cognitions can make the sleep worse, and that means that you can learn to have adaptive strategies and reduce your sleep interfering cognitions and thus change your behaviors to make your sleep better. One precipitating mechanism that is certainly causing a lot of sleep problems for individuals is COVID-19, and there are many reasons for this. First, people are experiencing a disruption of their usual daily routines and have no anchors for maintaining their routines. This is going to definitely throw off your night-day schedule. People aren't going to school or work at the same time as usual. There's no clear anchors to keeping a routine for a time to get up, a time to regularly eat your meals, a time to exercise, a time to go to bed. And in fact, people have a tendency to nap or lay in bed or oversleep because they're home and their daily routines are thrown off. This is particularly problematic. In addition, precipitating mechanisms such as anxiety and worry about the virus and stressors related to the virus can lead people to not be able to shut their brain down at night when they're trying to sleep. Instead, their brain is filled with worries. Individuals are also experiencing a great deal of family and work stress. This may also keep them up. But it can also lead to stress-related fatigue. And when people are feeling fatigued because of their other stress, it may cause them to lay down for a rest, nap a lot, which then, again, can further affect their sleep. COVID-19 has also been associated with an increase in depression, in grief, and in isolation, and these are also linked to sleep problems. Finally, in the isolated world of COVID-19, everyone is experiencing excess screen time. We're on our cell phones, we're on our Kindles, we're on our computers, we're on our laptops, and these give off blue light in a range of the electromagnetic spectrum that is interpreted by the eyes and the brain as daylight. This delays the release of melatonin. These alerting light signals are basically telling your brain to stay awake, and particularly if you're using these close to bed, they're telling you to stay awake right when you should be telling yourself to fall asleep. So, what are some pieces of advice that I can give you to try to help you manage your sleep? We're going to focus in the rest of this video on what's called sleep hygiene. These are sleep-related behaviors that you can engage in to help improve your sleep. And they're 24/7. Just like sleep is a 24/7 activity, so is sleep hygiene. Let's start with what you can do when you first wake up that will affect your sleep the next night. First, you should fix your wake time and stick with it always, regardless of whether it's a weekend or a weekday, regardless of how much sleep you actually got on any given night. You should always have a pretty consistent wake time. In addition, you should get out of bed within a few minutes after your alarm rings. This means not hitting the snooze button. This helps your body understand that bed is for sleep. And if you need to put your alarm clock or your cell phone or whatever you're using to alarm you to awaken across the room so that you get out of bed, then do that. You should not be checking your Fitbit for how you slept the night before. Fitbits are not particularly accurate indicators of a night of sleep. They're more indicating how much you moved at night. And people can set themselves up to have an expectancy or a self-fulfilling prophecy. If their Fitbit tells them they slept poorly, then they can fully expect to have a poor day. And that may not be accurate. There are additional sleep hygiene behaviors you can engage in as your day progresses. First, you should get some exposure to daylight, preferably in the morning. This helps with your process C, or again, the circadian process of the 24-hour light day cycle that helps set your clock. Second, you should try to limit your napping. As I pointed out before, this decreases your process S, or your sleep drive, if you're napping too much. If you are very sleepy, such that it might affect your safety in performing activities such as driving, then a 15 to 30 minute nap can certainly be taken, but it's best to do that 7 to 9 hours after your morning wake time, trying to take a nap at the same time every day, napping in your bed because it will help you associate your bed with sleep, and setting your alarm so you don't nap too long. As you approach bedtime, there are also several behaviors that you could try to avoid that will help you sleep better. The first is alcohol. While it may facilitate sleep onset, it actually leads to restlessness and disturbed sleep later in the night, which will overall result in less refreshing sleep. You should also avoid caffeine. Caffeine is a long-acting stimulant, which means it can keep you aroused right when you want to fall asleep. What many people don't realize is it can last for several hours after it is consumed, and for some people, they need to limit their caffeine use to before lunch only in order to not have a bedtime or nighttime effect. Caffeine is found in more things than you think. Certainly we think of coffees and teas, but even decaf coffee and decaf tea have some caffeine in them. There's also chocolate and soft drinks and energy drinks, even some non-herbal teas have caffeine in them, so you have to read labels carefully. You should also avoid nicotine near bedtime. If you are a regular smoker, it's best to try to avoid doing that at least 2 hours before bedtime. Keep in mind, though, that if you are a regular smoker and you do try to quit, this can lead to withdrawal symptoms that include increased sleeplessness for several weeks. Finally, there are many medications that can potentially interfere with sleep, such as asthma medications, decongestants, allergy and cold medicines, steroids, beta blockers, stimulants, even some antidepressants. It's important to check with your prescriber about the time of dosages if you are noticing sleep effects. Notice that I also mention over-the-counter medications here. It's very important for you to never change your medications without consulting the person who prescribed them, but you want to make sure your prescriber knows everything you are taking, even if it is over-the-counter medications, vitamins, supplements, melatonin, using alcohol, etc. to manage your sleep. If you are on sleep medications, it's also important for you to realize that use of them can produce carryover effects in the morning, and they also can lead to dependence and tolerance. Again, it's important to talk with your healthcare provider and the prescriber about any of these effects. As you near bedtime, there are additional activities that you should change or monitor in order to improve your sleep. First of all, if you exercise too close to bedtime, it will raise your body temperature. This will interfere with process C and make it harder to fall asleep. So it's best to avoid exercise about 4 hours before bedtime. Now, this would be exercise that increases your body temperature. So if you plan to do some gentle stretches or some yoga, that might be relaxing and actually supportive of sleep. You also want to be careful with eating meals too close to bedtime. This can lead to indigestion and acid reflux, which will interfere with sleep. So try to avoid heavy meals about 4 hours before bedtime. A light snack before bed is okay if you're somebody who tends to wake up feeling hungry in the middle of the night. It's also a good idea to create a transition zone for yourself. This would be setting a time aside to unwind before bedtime. It might include your regular bedtime routines, such as brushing your teeth and putting your pajamas on, but could also include relaxation, light yoga, soft music, reading a book, giving yourself a quiet, calm state of low arousal. Keep in mind that you don't want to do any of those activities in your bed, but outside of your bed. And as mentioned before, you don't want to use computers, cell phones, even energy-efficient light bulbs without using a blue screen filter in the couple of hours before bedtime, or you're going to send those alerting light signals to your brain that will tell you that you're supposed to stay awake right when you want to fall asleep. Finally, set your earliest bedtime, but don't go to bed before you are sleepy. Even if you have set your bedtime, if your brain is telling you to stay awake, it's best to stay out of your bed. What you want to try to train yourself and train your body in believing is that bed is for sleep. So don't go to bed before you are sleepy. And remember, the next morning, get up at your wake time no matter how your sleep was the night before. What we have focused on here in this video is just providing you some basic sleep hygiene that may improve your sleep. You may find that this helps, especially if your sleep is a temporary problem and you're able to address the stressors that precipitated the sleep problem in the first place. However, if you're interested in getting some help managing your sleep, we at the Ohio University Psychology and Social Work Clinic are offering brief, virtual, group-based psychoeducation about sleep, which is based on the cognitive behavioral therapy for insomnia model. This particular intervention will involve 3 sessions, each which will occur 2 weeks apart. There will be homework to apply what you learned between sessions, and you will need to complete a pre-treatment sleep diary to get a full benefit from the psychoeducational workshop. If you're interested in joining one of these sleep groups, you can contact the Ohio University Psychology and Social Work Clinic to sign up or to receive more information. Our phone number is 740-593-0902. Note that the sleep group is 3 sessions over a 6-week span and only costs $30. I hope that this has been helpful in addressing some of your sleep concerns. Take care.